Hi, Mr. Mayor.
Hello.
Did you know that many people in your community are getting sicker and sicker because they can't afford to purchase their prescription medication?
Really? Can you tell me more?
Sure. Many of your constituents are choosing to leave their prescriptions at the counter in exchange for purchasing food for themselves and their families.
Interesting.
The Centers for Medicare and Medicaid revealed that in 2014, there was a 12.6% increase in spending related to the cost of prescription drugs. The impact of this is that patients become non-compliant with their medications as a result of their inability to pay the high out-of-pocket cost. This results in less than optimal healthcare outcomes. This particularly impacts the population with chronic illnesses such as diabetes and hypertension. These patients' diseases are quite manageable with their medications. However, if they don't have access to the medications, they get sicker, present to the emergency center, which results in a higher cost of paying for emergency care.
Interesting.
This not only impacts lower socioeconomic part of the population, but it really spans from the poverty-stricken all the way to middle class, as evidence has shown that if 5% or more of household income is spent on healthcare needs, it presents a financial burden to most families.
Is there any way I could prevent this from happening?
Absolutely. There are two ways that you can prevent this from happening. You can support or present legislation that will allow Medicare to negotiate directly with the pharmaceutical companies, as this has proven to lower the cost of prescriptions to the consumer. The VA currently has a system where they negotiate directly with the pharmaceutical company, and this has resulted in a lower out-of-pocket cost to the veterans, not to mention the benefit of increased medication adherence and better healthcare outcomes. The other way that you can support this is by putting restrictions on the monopoly that the pharmaceutical companies have on patent for brand name medications. This results in very significant delays in more cost-effective generic brands getting to the customer. In addition, the generic brands have proven to be just as effective as the brand names. Some pharmaceutical companies have even instituted secondary patents on their brand name medications. So by supporting or presenting these two legislations, you can have a positive impact on the constituents in your community and across the nation. Thank you for your time.
Thank you.